Hey everybody, my name is Mike Terry. I'm making this video to try and hopefully help others in this situation who may have a similar scenario as me or have been going through something similar to this. I know for the last couple months I've spent a lot of time watching YouTube videos and reading up on Reddit and really just like diving into sort of how other people have dealt with this and sort of their journeys and their experiences. So I figured I'd add another one because I know I got to the point where I'd almost watched like every L5-S1 microdiscectomy video on YouTube. So another one I figured wouldn't hurt. So to start, I injured myself in January of 2021. I was moving apartments. I moved across the street. So I said to myself, I'm not going to hire movers. I'm not going to, I relied on a friend towards the end to sort of help me with a couple things. But for the most part, I did it all by myself. I was moving couches and beds and TV stands and shelves and, you name it, things that are just way too heavy and way too strenuous for one person to move. And that was a terrible decision. And, I do regret it, but it is what it is, right? So that was, January 1st of 2021 is the day that I moved. I would say about in the 2 to 3 weeks after that, I started experiencing some strange lower back pains. I am relatively young. I'm 28. I'll be 29 in a couple weeks. But I started noticing these sort of strange feelings that I just didn't typically have. Sitting down would feel a little funky. Being in the car, sitting at my desk. All of that was a bit painful. And, I did all of the wrong things. I was doing hamstring stretches. I was bending down and touch my toes. It wasn't good. I certainly made the herniation worse. I couldn't even tell you if at the time it was herniated or bulging. I don't know. But I was in pain, and it got to the point where after, trying those stretches and doing those things, it got me significantly worse, to the extent where I couldn't really stand or walk or move. I would just lay down and cry basically for most of the day. Eventually I reached out to my brother. I had him take me to an orthopedic walk-in, did an x-ray, got a trigger point injection while I was there, which is just in the sort of like the external tissue, right? And I would say that helped. They gave me a steroid pack, and I would say that that sort of helped in the acute phase in terms of taking it from a 12 out of 10 in pain down to maybe a 7, right, for that short period of time. And I guess that 7 is sort of kind of where I plateaued, and that was probably in February, March of 2021. Went back to that ortho walk-in to the same doctor I had seen, the month and a half, 2 months prior, and spoke to him about how I'm feeling, what's going on since my initial visit, and he prescribed physical therapy at that point, and I did 6 weeks of physical therapy at that point. So that was from about, let's say, beginning of April to mid-May of 2021. After that 6 weeks of physical therapy, I really still wasn't finding much relief. I wasn't finding myself to sort of be where I want to be. Not even close, right? I would sit and stand and everything would still be in pain. So I went back to that same ortho walk-in, same doctor, and he prescribed an MRI. I got the MRI. There was a pretty clear herniation at the L5-S1. And at that point, he referred me to pain management, and I went for my very first epidural steroid injection in June of 2021. So in June of 2021, I had that first epidural steroid injection, and I would say, so that was around mid-June 2021. I would say towards the end of June to the mid of July, I started to feel really a lot better. July 2021, yes. And, I took a 6-hour flight in July. I left the country. I went on a vacation, and things were I was feeling okay, and then as time went on, July, August, September, feeling okay. I'm thinking this is over. I'm thinking, wow, I can't believe the injection actually worked after, everything I read online. October 2021 rolls around and the pain comes back with a vengeance. Not sure if I did something to cause the pain to come back. Not sure if it's just that the epidural wore off. But ultimately the pain was back, and I decided to go back to that pain management specialist that did the initial epidural injection and go for a second. And that ended up being in November of 2021. And I would say that I didn't have nearly as much relief from the second injection as I did the first injection. It may have been like a short period of time of sort of decreased pain, but I ultimately ended up kind of getting back to where I was prior. So yeah, that was November of 2021. So come January of 2022, 1 year after the initial herniation, I decide that I'm going to start physical therapy again. I want to give it another effort with physical therapy. I want to see if maybe, since I did physical therapy prior to my first epidural injection, maybe doing physical therapy after my second epidural injection, right? Switching up the order that I was doing it in, maybe that would provide me with relief, or that would be the right thing for me to do. So I did my second round of physical therapy between January of 2022 and I guess mid-February of 2022. And still, I find that when I was active and I was doing these things, it was helpful for me. One, because it takes my mind off of the pain rather than, sitting at my desk and hammering away at work while I'm just thinking about the pain that I'm in, or even standing at my desk, which I'm doing right now. Yeah, I would go for walks. So after February of 2022, I sort of kind of took it into my own hands. I would do the stretches at home. I would go on walks outside. I got to a point where I was walking, a few miles a day, because it wasn't really painful to walk or stand. It was painful to sit and lie down and sort of be sedentary. So yeah, so I did that from about February of 2022 to. And then I hadn't seen anybody between February and July of 2022. So in July of 2022, I decided to go to an entirely separate facility, not the initial ortho, not the initial person I saw for my MRI and my pain management. I went to a separate facility, and I had a consult with an orthopedic spine surgeon. And since it was roughly a year since my initial MRI, he ordered another MRI. And I do suffer from some claustrophobia. In my initial MRI, I actually had to pull out about halfway through because laying on my back hurt so bad, number one. And number two, just the claustrophobia and feeling like you're in a coffin, it gave me extreme discomfort. So I opted for a sit-stand MRI for my second one that I had in July of 2022. And that sit-stand MRI, still painful to sit down, but you're not in a tube this big, and I'm not a huge guy. I'm 5'8", 175, 180, so relatively average. I'm probably 20 pounds overweight, but it wasn't so much that I was sort of smushed in the tube. It was just the idea of that, like, I don't know, even with like an eye thing on, it's just like that it's this close to your face. I don't know, maybe I'm a strange person, but anyways, if your neurosurgeon or orthosurgeon does give you the option for a sit-stand MRI, and you are, a claustrophobic person, or tight spaces make you feel uncomfortable, you should definitely consider that as an option, because it did give adequate imaging for the orthopedic spine surgeon to see where I was at. So after that sit-stand MRI, I got the imaging back. He had compared it to the initial one, which wasn't a completely valid study, the initial one, right? Because I sort of pulled out halfway through, so they didn't have the entire lineage of images, sort of, the below view, the above view, and every side view and everything. So ultimately, it was a centralized herniation at L5-S1. It was herniated. It was not bulged. It was completely herniated. And since it wasn't on either the left or right side, it wasn't impinging on those nerve roots that go to the left or right? It was directly backward, as central as they come. I wish I could show an image. I don't have I have a picture of it on my phone. I'm recording this on my phone. So, but it was truly, truly central. And it was facing the thecal sac. That's my cat Victor. It was facing the thecal sac, which obviously holds all those nerves, right? And he sort of said, listen, if this was jamming on your nerve root, I would say this is at 100% the cause of your pain that you're having in your lower back and your leg. But it just seems that it's effacing the nerves, right? So effacement versus impingement. Effacing is sort of touching. Impingement would be pressing, is the way he sort of explained it to me. And at that point, he gave me the option, right? He says, hey, Mike, if you want to, attempt conservative treatment a little longer, I don't think you would be silly to do that, because you're at a stage now where it's not impinging, it's effacing. And I said to him, listen, I've done the 2 rounds of epidural steroid injections. I think I've exhausted everything I can before surgery. He said, listen, you're the only person that can make that decision, right? And I think in general, sort of when it comes to my health and many things, I'm a pretty conservative guy. So I went to go see another pain management specialist that he had recommended from his practice. We spoke, nice guy, very honest guy. He said, listen, Mike, you've done this twice. You did get some relief from the initial, but not the second. And he, excuse me, he said to me, I think the same as the surgeon, right? If you decided to go for the microdiscectomy, you wouldn't be crazy. And if you decided to continue conservative treatment, you wouldn't be crazy. So, I mean, they're really just completely leaving it up to me. And, after having these talks with my loved ones, my friends, my family, I made the decision to schedule the microdiscectomy. So that was in the beginning of August. I had finished up all those consults, did my MRI. So I had my initial consult in July, did my MRI in July, follow-up consults in August. And then around mid-August, I decided on that MD, and I got it scheduled for September the 8th, which was yesterday. So as for that's everything leading up to the MD. So I'm sorry if that was very long. I hope some of it was helpful. But so leading up to the MD, did my pre-op appointment a week prior. They take some blood. They ask you questions about the drugs you're taking. They'll tell you when to stop those drugs prior to surgery. They'll give you the whole spiel. Everybody was very thorough with me, which I greatly appreciated. Then comes September 8th, microdiscectomy day. I was scheduled for a 4 p.m. procedure. I had to arrive at the hospital around 2:30. So, I had my brother help me out. He drove me to the hospital. I checked in, got in my room. They get you in a gown. They hook you up on an IV. You're hanging out in the room. Surgeon comes in. You chat with him. You sign your consent. Anesthesiologists come in. You chat with them. You sign your consent. And they're just hanging out until the OR is prepped. They roll you into the OR. You bullshit with them for a couple minutes. They pop the mask on you, and you're out. You're just out. And you wake up in the recovery room. You're gonna be a little out of it. You're gonna be groggy. Your brain's gonna be foggy. You might be saying some things that feel like you're drunk or whatever. I don't know. But ultimately, everybody was so incredibly helpful to me. When I woke up, I didn't really feel much pain in my butt. I do currently still have some nerve sensations in my leg, I would say. Most of the pain is currently focused in my lower back where the incision was. Surgeon came in after surgery, also, called my brother, filled him in on everything, said the surgery was successful. The herniation ended up being much larger than it appeared on the MRI. So, kind of the way he posed it to me was, if he had seen that level of herniation on the MRI, he likely, rather than saying, hey, Mike, try conservative pain management or go for MD, it's up to you, he would have likely leaned towards the MD given the size of the herniation. Now, I don't know if that's something that's just said to many people to ease their mind or whatever, but ultimately, at the end of the day, it did ease my mind a bit in that it validated the pain that I was having almost. Because, I would look at my MRI and I would say, listen, I see other MRIs on Reddit and Google and everything, and it's like, some of these people got some huge huge herniations, right? And so I was thinking to myself, leading up to the surgery, is it just that I have a bad pain tolerance and my herniation isn't actually that large? Is it, what is it? And so now it's 8 a.m. on the dot on September 9th, and I got home last night around 9 p.m. So it hasn't even been 12 hours yet, and I'm standing. I had a decent night's sleep last night, getting into bed, doing the log roll, sleeping on my right side. The pain and the herniation gave me on the left side. So I slept on my side. I kept my cat out of the bedroom last night because he loves to jump all over me and get a little wacky and crazy. So I figured it was probably best to sort of keep him out of the bedroom. Hopefully in a couple nights I can let him back in because he does love sleeping with me. But I just don't know that it's wise for him to be jumping all over me and such. So I have a desk job where I can work from home and work in an office. Sort of, I do like a split. But I do plan to take a few weeks off work just to really, I think recovery is the most important part of this surgery if you're getting it. So I think that's something you have to take incredibly seriously, and I do plan on taking it quite seriously. I meal prepped like crazy. I have grabbers. I got a toilet seat riser. I have a standing desk. I got a pregnancy pillow. I got more pillows in my bed. I think I did a pretty solid amount of prepping. They just got me on 5 milligrams of oxycodone right now, which, they say to take every 4 hours or as needed. I kind of do plan to take it every 4 to 6 hours. Today's Friday, I think. So hopefully I can wean off of that by next week. But, I'm just going to see how I'm feeling and really play it by ear. I really hope this is helpful for people that are sort of going through this. I watched so many videos, so I figured I would be doing my part to add another one. So I hope to give an additional follow-up in, today's not even, I'm going to call this the 24 hours after microdiscectomy video. And then I hope to provide one weekly after that. So, but if anybody has any questions or they have concerns about surgery or preparing for surgery or they're on the fence of whether or not they should do this or not, you're really the only person that can make that decision. But I really hope this video provides you some help. And if you have anything you want to ask me, any questions, please just leave a comment and I'll get back to you. I'm going to be hanging out in my apartment for a couple more weeks, so I'm really happy to chat with anybody and give any sort of advice that I can. I'm not a medical professional, but talking to someone who's gone through something that you are going through is often very helpful. So please do. Thanks, everybody.